iron can catalyze and help to cause oxidation of low-density lipoproteins within the atherosclerotic plaque. So it's sufficient to say that iron overload and iron excess can drive the process of cardiovascular disease, of cardiovascular dysfunction and the coronary artery occlusion and the narrowing of the arteries. So we have a tool, my friends, that is very affordable, that has been clinically studied, that has been shown in diabetic patients and also in patients with cardiovascular disease to reduce the prevalence of those conditions. So some of the things we'll also talk about today is fatty liver disease and how fatty liver disease can actually be reversed by just donating blood. There's a paper actually, we're going to talk about it. I'll just give you a little hint at what it's called here. Iron depletion by phlebotomy improves insulin resistance in patients with non-alcoholic fatty liver disease. We know fatty liver disease, unfortunately, is so common. It's not just from eating dietary fat, okay? We know that insulin and hyperinsulinemia causes changes in iron metabolism, iron absorption, and all aspects of iron physiology and ferritin metabolism. So this paper found that in individuals who have a histologically defined non-alcoholic fatty liver disease, that just donating blood over the course of several weeks dramatically improved their blood sugar handling. But I want you to ask, when was the last time a doctor told you or someone you know who has insulin resistance, obesity, fatty liver disease to donate blood? They say, no, you need to take this drug, take this medication, we'll see you in 6 weeks. But you never hear about donating blood. But this is so important because it turns out that iron overload, excessive iron, we'll talk about how you can quantify this looking at your labs, gets stored in the liver, gets stored in the pancreas, gets stored in the heart, and it can even impact the brain. So we have a simple modality. I just donated blood yesterday. You might be able to see this little prick. I don't know if that comes through on the camera, but I donated blood yesterday. I'm on the sort of my cadence is every 6 months because I'm one of these males that tends to have a higher hemoglobin, hematocrit, and ferritin. But hemoglobin, hematocrit, and ferritin are things that should be on your radar. Again, if you're a male of any age, or especially if you're a postmenopausal or perimenopausal woman, because it turns out that after menopause, women naturally sort of bloodlet, when they're menstruating. And when that stops, they can accumulate iron. Senescent red blood cells. Red blood cells are at the end of their lifespan. When they die, this is how your body gets iron. And so it's just this turnover. And that process is impacted by hormones, by insulin, by glucose, and things like that. So it's not just dietary heme iron that is part of the problem. This is a natural process that happens in the body when your red blood cells are broken down. About 90% of your daily iron needs, do all the oxygen transportation and so forth. Part of that iron, your needs come from the breakdown. A huge part of that comes from the breakdown of red blood cells. Okay, let's say that you're going to cook some hamburgers because Father's Day is around the corner. You're going to cook some hamburgers, right? Imagine if you have the air conditioning on in your house and you leave those hamburgers in the house and your house is like 30 degrees. You could leave those hamburgers on the counter for like hours, right? But if you were to turn the heat on in your house to 100 degrees, like you want it to be really hot, let's just say, right? You want to create a sauna in your house. Those hamburgers would start to rot after 2 hours, right? They would start to break down, bacteria would grow, you probably would not want to eat them. So the heat there is the catalyst. That's what iron is doing in the pathophysiology of your vessels and the inflammation and the oxidative stress that it creates. It's just a catalyst. So if you have the hormonal metabolic environment, the nutritional environment with a lot of low density lipoproteins that are highly oxidizable because you're eating omega-6 oils in your diet, and you have high iron, right? Because you have iron overload, insulin resistance, and the sort, you're catalyzing the formation of oxidized LDL in your vessels and causing more free radical damage in the body. Okay, so iron is just the catalyst. It's not inherently bad or good. You need iron to transport oxygen in your hemoglobin, right? This is part of how you deliver oxygen to your tissues is iron. So it's not inherently bad. It's when we have supraphysiologic levels of this. We're going to dive into that. So this paper does a great job. So what is iron? Iron is basically just a mineral. These minerals are catalysts, right? It's a redox metal, and it's the main component of hemoglobin that is essential for oxygen transport, okay? And how it increases, as I mentioned earlier, is the breakdown of red blood cells, okay? specifically the senescent erythrocytes. So we've talked about how cells, when they get to the end of their lifespan, they undergo cellular senescence, they apoptose and die. The challenge here is the accumulation of senescent cells, for example, within the brain, within the liver, within the heart, that release that senescence-associated secretory phenotype that accelerate aging. So again, this is a beautiful aspect of senescence here with regards to how iron is increased, is this apoptosis and death of these cells, of the red blood cells. The nutritional metabolic environment influences that process. The more insulin resistant you are, that process is augmented, is accelerated. Here's, I think, just a great visual. Here's your blood vessel lumen, and what you're seeing here is the development of atherosclerosis. So this figure really conveys the story. And what you see here is free iron is accelerating the process of the oxidation of the LDL, which is causing the occlusion or the narrowing of the vessel. So when people talk about oxidized LDL, what may be causing that? What's the driver behind that? Excessive iron could be a driver. And so you add in, the fact that people are eating a lot of fried foods, the canola oil, the sunflower oil, the, cottonseed and soy and whatnot. Their lipoproteins are much more oxidizable. There's some insulin resistance going on, so there's a lot more small, dense LDLs floating around, and then you have iron overload. You have this recipe for developing heart disease. I believe this was published in 2007, okay? Iron depletion by phlebotomy improves insulin resistance in patients with NAFLD, which is non-alcoholic fatty liver disease, and hyperferritinemia. So what this study found is every 15 days, they had individuals who had, ultrasound, diagnosed fatty liver disease. They donated 350 milliliters of blood, and they noticed obviously changes, improvements in ferritin and hemoglobin. But what was sort of unexpected was changes in liver enzymes and markers of insulin sensitivity. So there's a few tables here. I don't want to go into all of the details, but let me just sort of share with you the improvements. And I think what we don't recognize, I think, as a community is the importance of liver as a factor improving metabolic health. Your liver is the organ that is regulating glucose metabolism, glycogen resynthesis. And I mean, your liver is so important for overall metabolic health. And it also happens to be the organ where if you have elevated levels of iron, that gets stored and damages your liver. So it's hard to have good blood sugar control and dynamics if your liver's loaded with iron. And so that's where phlebotomy and donating blood, if we just pause here and think about, it's good for you, but it's also good for someone else who has surgery or they're in a traumatic event where they get shot and they're in a car accident or something like that. You could help save their life because there is a shortage. So they go on to say that because the degree of hepatic insulin resistance and hyperinsulinemia is associated with cardiovascular damage and liver disease, these results suggest that iron depletion by phlebotomy could favorably influence a natural history of patients with NAFLD. Okay, NAFLD, non-alcoholic fatty liver disease, very common. There's going to be a shortage of livers because people literally, their livers are being eroded. But the improvements in the HOMA-IR and various scores were quite profound here. Statistically significant in these groups, we're talking it was like a 15-point swing in the group that was tracked that didn't donate blood over the course of the study versus a group that did. Let's talk more about heart disease and blood donation. And I'll just share with you two studies, and we don't need to break them down and look at all the nuances here. But this one, I think this was in the BMJ. I'll link it below here. The title here is Cardiovascular Risk in 159,934 frequent blood donators while addressing the healthy donor effect. So this is the problem with some of these studies is looking at, okay, what is the outcome or the upper bound benefit of donating blood with regards to reducing cardiovascular risk is you have this healthy donor effect where if you're a type of person that's going to donate blood, you're also probably the type of person that may eat good foods and may exercise. So is there confounding variables? Well, they did these Dutch scientists did some analysis here that statisticians can do to sort of control for that. And what they found is that, in fact, on the long term, over the course of years, we're talking high frequency blood donation is protective against cardiovascular disease. So we have outcome data.
DoctorsToTrust.com. World's #1 site for short, annotated nutrition videos. designed to share with loved ones.
Zinc is involved. It's a mineral that is involved in over 200 enzymatic reactions in the body, similar to magnesium. We know magnesium is involved in over 350 some odd enzymatic reactions. But what's unique about zinc is its underappreciated role when it comes to supporting hormonal health levels in men. It's quite exciting, the mechanisms of action as to how zinc has been suggested to improve testosterone levels. Is quite interesting. So we know that hypogonadism affects a lot of individuals, not only just elderly, but now we have many young men that are hypogonadal. And it's been recommended that zinc in the dose range of 200, let me just read to you exactly what they say. In general, a common safe recommended dose of zinc would be twice per day for the course of 4 months of 220 milligrams of zinc. Yielding an equivalent of 50 milligrams of elemental zinc. So you want to look at your manufacturer on this. So in the studies, they use zinc glycinate or zinc sulfate, which is yielding about a 40%, 20-30% zinc. So elemental zinc in the realm of 50 to 100 milligrams has been shown to improve low testosterone levels in men. And we know the clinical treatment for testosterone in men is often recommended that men get TRT and things like that. But the problem with that is once you go on TRT, that does suppress your hypothalamic pituitary adrenal gonad axis. So there are downsides about just jumping on TRT. But as the scientists say here, the importance of zinc in various metabolic pathways, including the spermatozoa, is well established. Zinc acts by improving the morphological and functional aspects of sperm, and it also improves the functionality and biosynthesis of testosterone. So again, I want to share with you, for those of you that are trying to conceive, you're having maybe fertility problems, and you're looking for solutions to improve your fertility, consider zinc. There's a lot of evidence to show that zinc actually improves sperm motility. When your body stores are deficient in these very important minerals, these enzymatic reactions suffer. And so that's why it's important to eat a whole, real foods-based diet. Avoid phytates and things that will bind up these minerals. And also, if you exercise, if you go in the sauna, if you stress your body in the sauna, we know hormetic stress is good, but when you sweat, you actually release zinc as well as sodium and other minerals as well. So you might want to consider, if you're experiencing low testosterone, supplementing with 50 to 100 milligrams of zinc. I suggest 20 to 30 milligrams of zinc per day. Now, if you have issues with testosterone, or if you go in the sauna, if you exercise, if you do these things, then yeah, you should probably increase the amount of zinc that you're taking. So I personally, if I go in the sauna, I'll take 50 milligrams that night. And it certainly does help with testosterone. If I eat enough meat, will I get enough zinc? Well, it depends on the quality of the meat and probably the cut of the meat. I want to say a ribeye has around 5 milligrams of zinc in it. So that's important to recognize. So whole real foods you get minerals from whole real foods, obviously. But again, if you're stressing your body with exercise, with fasting, with sauna, this is where supplements can come in. It says, what about copper? Yeah, zinc and copper, there's an intricate balance there. Very important to recognize. Do you need to supplement with copper? Well, it depends on where you live and if you're drinking filtered water. People that live in the southwest part of the US probably don't need to supplement with copper. So should you consider copper? Probably, yeah, but low doses, okay? But I think honestly, because zinc is lost in sweat, that's important to recognize. So if you're exercising, you're going in the sauna, zinc is being excreted in your sweat. And what this study found, this is an old study, what this study found is low zinc levels were strongly associated with low testosterone. What is zinc doing that is impacting testosterone? In addition to the correlation between cellular zinc and serum testosterone concentrations in the cross-sectional part of our study, the association of induced marginal zinc deficiency with decreased serum testosterone concentration and a significant increase in serum concentration following zinc supplementation in the elderly underscores the importance of zinc for maintenance of serum testosterone in apparently healthy adults. Our data are in agreement with an earlier study where a more severe dietary zinc deficiency was induced in human volunteers. And again, is when scientists cause a zinc deficiency in males, their testosterone goes down. Now, you might be saying, who's subject to a zinc deficiency? Well, people who aren't eating any animal products in the diet. I mean, I can tell you that, if you're eating kale and garbanzo beans, you may not be getting sufficient zinc levels in your diet. And this is where supplementation comes in. Because again, people have asked, well, how much zinc do you need? Well, it depends on what your dietary intake is. And so there's many applications and online trackers of different macronutrients and micronutrients. So I think it's good to look at the foods you habitually eat and throw them into an online calculator and look at the how much maybe you eat. I eat like 10 eggs a day, backyard chickens. We eat ribeyes. We have half a cow in the freezer and do roasts and all these different things. I'm probably maybe getting 7 to 10 milligrams of zinc a day. Now, if I exercise and I go in the sauna and I'm sweating in this, I'm probably excreting 3 to 4 milligrams a day, roughly, something along those lines. So over time, I could potentially induce a zinc deficiency. And so that's why, I think it's important to supplement periodically with zinc, especially when you're sweating. But I think it's so fascinating that just a marginal deficiency in zinc results in a decreased level of serum testosterone. And zinc supplementation raises serum testosterone in men with mild zinc deficiency. Zinc status appears to represent an important determinant of total serum testosterone levels.